9 tips for the management of persistent concussion symptoms. It is important when you find practitioners to assist you with the recovery from your concussion that they have experience managing patients with concussions. Number 1, physiotherapist. The physiotherapist can be helpful in several regards, including increasing your physical activity in a gentle manner, and also in some cases, they may be trained in vestibular therapy to help with your balance. Number 2, occupational therapist. An occupational therapist can be extremely helpful with cognitive strategies. For example, if you're forgetful, you have difficulty multitasking, coordinating activities, they have several strategies to assist you in this manner. Number 3, a psychologist. A psychologist can be helpful in administering cognitive behavioral therapy that can help with the anxiety that develops as a secondary outcome of the traumatic brain injury. This is extremely common, and the psychologist, if trained in traumatic brain injury, can be helpful in this regard and aid in recovery. In some cases, you may also require a referral to a psychiatrist. When we look at SPECT scans of patients with traumatic brain injury, we often see findings in the inferior frontal lobe, the temporal lobe, where there's decreased perfusion in blood, but also in some cases the thalamus that has an increased perfusion. And this represents depression, anxiety, and mood disorders. This can be a primary outcome of the injury itself, injuring that part of the brain, or a secondary outcome of the traumatic brain injury. In any event, it is very common to have mood disorders, depression, and anxiety following a traumatic brain injury. Number 4, a speech-language pathologist. The temporal lobe, with the arcuate fasciculus between Broca and Wernicke's area, is responsible for speech. In many cases, patients have stuttering, difficulty getting words out, difficulty with word retrieval and word finding. A speech-language pathologist can be helpful with exercises to improve in this regard. Number 5, an optometrist. It is common to have vision challenges following a concussion. Anything ranging from oculomotor dysfunction to convergence disorder, and in some cases, exercises can be beneficial through vision therapy, but it is important to identify somebody who has experience in this area. Number 6, in some cases, massage, acupuncture, craniosacral therapy, osteopathy may be helpful. However, this is often practitioner dependent, and I would recommend that you speak to others in your neighborhood and community that have had concussions, interview the practitioners, and have a realistic expectation of what benefit you may achieve. And if you engage in these treatments and you're not achieving benefit, it might be a good idea to reassess. Number 7, some level of DHA or EPA, which is an omega, might be helpful. There are studies from Texas Christian University that this supplement may be beneficial to the brain. Number 8, mindfulness meditation. You can use an app like Headspace or Calm. There are studies from Harvard Medical School that the mindfulness meditation can be helpful to aid in recovery. We often see this with our patients, that the mindfulness improves their anxiety, reduces their stress, and improves their recovery. And finally, number 9, do not be in a dark room. Also, at the same time, moderate levels of cognitive and physical activity. When I give you this list of 9 potential treatments to do, sometimes individuals that are so motivated to recover want to engage in all of them. However, you need to be careful not to overdo the treatments also, as that may also cause a relapse and set you back into recovery. Everything needs to be done with moderation. Therefore, 9 tips for the management of persistent symptoms of a concussion.